Welcome to Let's Talk, the half hour where we join various guests from around our community. Now, let's talk.
Welcome to the program, listeners. Tyler Friel with you on WISR 680 AM, 107.5 FM. This is Let's Talk, the half hour where we sit down and chat with various organizations, businesses, nonprofits, and more in our area. And once again, we welcome back today Independence Health System. We also have some guests here on behalf of Independence Health System, including Holly Burtner, who is the clinical director of the ICU at Butler Memorial Hospital. Holly, thanks for taking the time. Welcome to the show.
Thanks.
And we also have from CORE, which is the Center for Organ Recovery and Education. It is Jared Bodakovich. Jared, good to see you, and welcome to the show.
Thank you.
We also have a third guest who's joining us via telephone. That is Christine Baumcratz, who is the clinical coordinator at the ICU at Clarion Hospital, which is under the Independence Health System umbrella. Christine, good to have you here, and welcome to the show.
Thank you.
We have all the introductions out of the way, and as we always say for the next half hour, if you can't stick around for the full 30 minutes, we do have you covered. You can go online to WISR680.com, look under the Let's Talk page, and there you'll be able to find all of our shows with Independence Health System, including this conversation here today. We're also available on Spotify as well, so if you're a Spotify user, you can search for Let's Talk WISR and stream us there as a podcast. Plenty of ways to listen to us here on the Let's Talk Show, and of course on the air at 680 AM and 107.5 FM. So let us start with this, as April is National Donate Life Month. And Jared, I'll start with you because with the Center for Organ Recovery and Education, better known as CORE, this is obviously a really important month for you guys. What is the mission? What is the message here that you guys are trying to get out this month?
Sure. So if you didn't know, CORE is one of 50 organ procurement organizations across the country. So that just means that we work with partners such as Clarion and Butler and all our hospital partners to work in recovering, matching, and allocating organs, tissues, and corneas. So Donate Life Month is just one month where we celebrate donors, we celebrate transplant recipients, and we just kind of promote the message and make sure that people are aware of organ donation and try to get people to understand that it's very important that they register as an organ donor.
And I'm sure for you, especially, because a lot of people, I think, would have a lot of questions. We get it when we go to the driver. At least that was the first time I was introduced to it. You go to the driver's license center. Do you want to be an organ donor? And, my parents were, so I didn't really think about it. I said yes, But I'm sure for a lot of people, they go, well, donate my organs. What does that even mean? What does that look like? So for those who have a lot of questions about it, maybe let me ask you this. What's the number one question you hear from people about organ donation? Maybe some of the myths that are out there about it.
Sure. One of the biggest myths is, and that a lot of people, and we hear it all the time, is, if an ambulance driver or hospital staff or an ICU nurse or anyone looks at my driver's license and they say the organ donor logo on it there and they see that I'm a registered organ donor, that they won't do everything possible to save my life. And that's not true. So they aren't even looking for that. They're not doing that. They're trying to save your life. And we at CORE, we do not know anything about this until the hospital and family have decided that there's nothing else that they can do for you. So we don't even enter the picture until the hospital's like, we can't do anything else.
And Holly, would you like to confirm that as being somebody that's in the ICU, that this doesn't even factor into the level of care until maybe it reaches that point?
Oh, yeah, absolutely. Just like Jared was saying, they're at the very end of that whole process. You have to meet very specific qualifications to even be an organ donor at that point. So we're never looking at that until there's absolutely nothing else that we can do. Okay.
So, Jared, again, circling back to National Donate Life Month, whenever people in CORE is out there trying to promote this and promote the initiative, what's one of the really big messages that you try to tell people in terms of the impact that being an organ donor can have?
Try to think of it this way, as if either you needed an organ transplant or you had a family member. Wouldn't you wish that there were a lot more people out there that were registered as an organ donor to make sure that you or your loved one was able to receive an organ, that one of the greatest gifts ever, and have a second chance at life? I think that's like the most important thing that we try to instill in people, is don't think of this as something for a stranger, but think of it as something that you may need or someone in your family might need.
Christine, from your perspective, as you see it as the clinical coordinator of the ICU at Clarion Hospital, when you're talking to people about organ donation, or just even from that critical level of care that you guys are offering, just how important is it for people to be organ donors?
It is so important to be an organ donor. You never know. There are a number of people in our community and across our workforce that have received the gift of donation and have been given a second chance at life, pretty much. So it's so important to encourage organ donation, not only to, be that hero and save a life, or even up to 8 lives, through organ and tissue and cornea. But it also kind of helps the family, in that process, like when their loved one is passing, to know that their, son, daughter, niece, nephew, husband, whatever it may be to that family, that they can offer that gift of life to someone else. So I think it really helps that family heal even in their time of loss.
Holly, have you seen that from your perspective, the family who may be going through a tragic situation, but then realizes just how important that their loved one's life could be to somebody else's family?
Yeah, and that's one nice thing during Donate Life Month, too, is we get to hear from a lot of those donor families and to hear how it's impacted them in going through that process. And a lot of these families will reach out to each other, and as long as they agree, of course, and have built relationships with the people that their loved one has helped to, extend their life and help make better. And it's really touching to see that. And I've heard from a lot of those families and say how much it helped them through that process.
It is amazing. I anecdotally only know of one personal story of mine, but saw the family connect with the man who, unfortunately they lost their daughter, but they connected with this man from Wisconsin, and they have been close friends ever since, realizing just how important her listing herself as an organ donation. Jared, I'm sure you guys hear these stories all the time.
Yeah, we have a specific department that works with donor families and helps them write letters and everything like that. So there's a lot of people that do reach out. We have donor support groups where even if you don't hear back from a transplant recipient, you're still having a community of other donor families that have gone through the exact same thing, that feel the same exact way, and there's like a very good support group there. So just them knowing that they're not alone and that their loved one lives on helps a lot with that grieving process.
Jared, I think too, when people hear the numbers, it really does paint a big picture for just how critical of a need organ donors are across the country.
Sure. So if you want to think about it, Acrisure Stadium or Heinz Field, just have to put it in there, only holds around like 65, 70,000 people. There are more than 100,000 people in the country on a wait list waiting for a life-saving organ. So an entire stadium full of people doesn't match the number of people waiting. There's about 6,000, a little more than 6,000 waiting in Pennsylvania, and probably a little bit more than 2,000 in Western PA, specifically waiting for an organ transplant.
Wow. Those are significant numbers.
They are. So that's why this month is very important, of getting that message out there and trying to get people to sign up as organ donors.
Christine, at the ICU level, again, when you're working with people in critical care, and obviously you talked about the importance of this, but are people surprised? Are you maybe surprised how many people aren't organ donors, or is there maybe a barrier in that conversation as to why they're not organ donors? Just curious what your experience has been with that.
Yeah, it actually is surprising how many people are not registered to be a donor or an organ donor. And I think there again, it goes back to the myths, like Jared said, about how people are afraid that we won't save them if they're in a traumatic accident. Some other things, that people have thrown out there are, well, my heart's bad and I take a lot of medications, or I have damage to my liver, so that wouldn't make me a very good donor. And again, it's a myth, just as I said, that's a myth. Those are things that we need to clear up and tell people, and like we spoke, not everyone can be a donor. There's very specific criteria you have to meet. But just because you think your heart is bad or your liver is bad, you know, doesn't mean that you wouldn't be able to give somebody the gift of sight or maybe a lung or a kidney.
And Holly, I think that's an important point too. Let's say if I am listed as an organ donor, although my heart may not be able to be used as a transplant, are there other organs that I could have that could actually go on to be healthy and be useful?
Oh yeah, absolutely. So when you're an organ donor, it's not just, you know, your heart, your liver, your kidneys, your lungs, you know, cornea and tissue donation is very important as well. And that can be used to help people in many ways. So there's always other things that you can donate just because you can't donate one specific organ.
Jared, one of the things that, at least whenever I first started doing these interviews, that I did not know about was the cornea. I don't think people necessarily make that connection that, you know, a gift of sight could actually be used for somebody as an organ donor.
True. So I think you can give up to 2 people the gift of sight because of 2 corneas. You can, for tissue donation, 1 tissue donor can help heal up to 75 people, and 1 organ donor can help up to 8 people with 8 organ organ donations. So it's a lot. Another thing I wanted to talk about, because she brought it up, a lot of people have an age thing in their head that I'm too old to be an organ donor. That's also a myth. CORE held the record until this past summer of having the oldest organ donor, and he was 95. This past year, it was out in the St. Louis area. He was 98 years old. He was a liver donor. So age is not a factor. That, like Holly said, there's very strict criteria of being an organ donor, but let the hospitals, the OPOs, and the transplant centers, and the professionals and the medical experts decide that, and let your gift continue to go on.
Just speaking of numbers, then, I know CORE always keeps pretty good details on the exact organ donation. So do we have numbers from 2024?
Sure. We did have a 6th record-breaking year, and we had 970 lives saved through organ donation. Wow. So
that's a lot.
Yeah. It was a 17% increase from the last year. Yes.
I mean, Holly, when you have conversations with folks, are people becoming more receptive to becoming an organ donor, maybe the more they learn about it?
I always find that people, it's those myths that we always hear people say, but I think that people are accepting. I know Jared and I were talking right before we walked in, and some people just don't like having on their driver's license, but you can avoid that, and you can register just online. No one's going to know that you registered online. It's not going to be on your driver's license, so if that is something that holds you back, often when we say that to people, they say, oh, I didn't know that, you know. So that's one way that you can avoid things like that.
Christine, whenever, let's say it does get to this point where a conversation would need to be had about organ donation with a patient, that the patient's family is also very active in these conversations. Is that correct?
Yeah, the patient's family is extremely active. So from a hospital standpoint, you know, of course, we have done everything that we can do for that patient, you know, and it's been determined that either medically we can't do anymore, or maybe the family has said, you know, enough's enough, like we just want them to be comfortable. And then at that point, we do everything we can. We keep them comfortable. You know, we support the family, things like that. But then when it actually comes to the time when that person, that patient, stops breathing and, you know, they are no longer with us, then that's when we reach out to CORE. It's very important, you know, that we do our part here as the hospital staff, and we make that referral to CORE. We have that conversation. We, you know, talk about the patient, their history, you know, maybe review their lab values and things up to the point of when, you know, they cease to breathe. And then CORE kind of takes it from there. They kind of do that, reaching out to the family and having that conversation about specific donation.
Holly, how beneficial of a relationship is this between Independence Health System and CORE?
It's very beneficial. So, I am the advisory council representative for the hospital. So my job is to make sure that I reach out to CORE and anyone that they need to coordinate with. If we do have an organ donor, I get them in contact with those people with our hospital. And having that relationship and making sure that we have good connections there is very important for all of that.
Jared, also with CORE as well. Jared, for people, I think, we talk about the driver's license, but let's be honest. I mean, cross your fingers, you're never at the driver's license center unless you need to renew your license. But as they hear these conversations, I'm sure for a lot of folks, it's just kind of perplexing as to where they actually get signed up to be an organ donor. What type of avenues are out there for somebody who may not have done it the last time they were at the DMV, but is looking to do it now?
Sure. So one of the easiest places to do it is at the DMV when you're renewing your license or going in and doing any type of work that you need to do at the DMV. The other way is that you can go onto our website. It's core.org/register, and you just fill out the form, put in your information, and hit submit, and then you're registered. As it's easy as that.
It can be that quick then, huh?
So it's literally probably less than 2 minutes.
Wow. Whenever people, you guys talk with folks and kind of walk them through this, I'm assuming there's a lot of people, maybe if they were on the border, actually flip and go, oh, well, this seems like a no-brainer to me. Is that kind of usually where people go?
It usually is. There's a lot of myths and misunderstandings, and when you or I have a one-on-one conversation with someone about this, they usually just like, oh, I didn't know that, or I didn't know it was that easy, or I thought otherwise. And usually they come out of it going, oh, okay, well, I need to think about it a little bit more, or they're like, oh, I'll just register right now. So I think what the statistic is that there's 90% of Americans approve of organ donation, but only a little over 50% are actually registered as it. So there's just that little misunderstanding there and a little bit of hesitancy, but once people listen to the facts, listen to the experts, they're able to sign up as an organ donor.
Christine, have you found that to be the case in your experiences, that as people learn more about this, they are more receptive to becoming an organ donor?
Absolutely. And I think with the numbers that Jared's talked about, with how, 6 years now we've increased, we're on the uprise of how many lives we're saving. I think more and more people are coming into contact with someone who has received the gift of donation. So, years ago when it was fewer and further between, people didn't know people that actually got a kidney transplant. But now it's becoming a little more common, and it could be somebody that you go to church with, or someone that you work with, or someone that you cross paths with at Walmart, that has experienced this gift of donation. And I think it gives hope, and other people think, oh my gosh, I need to be an organ donor. Like, I too someday could help someone.
Holly, I'm assuming you kind of have that same feeling, but in conversations like this, it all kind of seems, not maybe real to a lot of people until they hear somebody or know of somebody who had that happen. Either they were the receiver of a kidney or something like that, or maybe lost a loved one who was able to donate and save someone's life. That's when it becomes real, and I think that's maybe what really paints a picture for a lot of folks.
It does. So I love, again, during Donate Life Month, when we get to hear from those people and hear those stories. A lot of times you're not planning for the worst day of your life. So,
whenever it does happen, there's at least, again, a conversation to be had about it. Yeah. Jared, obviously, we're talking about it from a lot of this conversation has been around the deceased donor. How does CORE factor in for maybe some living donations, and what does that process look like?
So we don't do any living donations.
Okay.
So most of the living donations go through like transplant centers, so they'll have a living donation that way.
Does the hospital have any role in that, Holly, that you know of?
No, not that I've taken.
Okay, sounds good. Again, we're talking with CORE and Independence Health System about Donate Life Month. Christine, from the ICU standpoint at Clarion Hospital, could you just kind of paint a picture of what you and your team go through, and how that relationship with CORE goes in? Because I think, again, ICU, not all of us are maybe have had that experience, but just from you on a day in, day out basis, what you guys experience, and then how having a relationship with CORE is beneficial to the hospital.
So having a good relationship with CORE is absolutely beneficial to the hospital. Again, we make sure that we are always keeping CORE on the forefront. We're constantly doing education with our staff, so that in the event that we do have a patient that possibly or potentially could be identified as a donor, we want to make sure that we have clear, open communication lines with CORE, that when we call, they're going to say, oh, yes, they're a great candidate for donation. We'll speak with the family. This is what you need to do to keep them in the best condition that you can. So we're constantly doing education. If for any reason, that CORE needs to reach out to us, they know that they can call us anytime, send us education to share with our staff. And we do a lot of that during April, Donate Life Month. We've got a lot of really fun, exciting activities planned for the staff and the whole hospital.
Is there any particular event that's out there and open for the community to check out, Christine?
Well, I can tell you here at Clarion, we do have our flag raising ceremony planned for April 9th at 1 p.m. So our flagpole is right out in the front of the hospital. Anybody driving by would be able to stop in, see it. We do have local media that also, participates, and they'll have a very nice presentation with that. We do Blue and Green Day for our staff on April 12th. So if you stopped in, patient, visitor, just coming through the hospital, you would see a lot of our staff dressed in blue and green. We have a day that we honor a donor family, and we find out what their loved ones' favorite foods were. And those are the foods that we offer in our cafeteria that day, kind of with a little bit of an explanation on why it was their favorite or whatever. So, it not only honors the donor family, but it's fun for our staff to participate in. We have a coloring contest that we put out to children that are somehow, involved with the hospital, whether it's the staff, children, or nieces, nephews, grandkids, whatever the case may be. And we have kids of different ages color some CORE coloring pages, and then we decorate hospital windows and the administration office window with the artwork, and we actually let the we let the patients and the visitors vote on their favorite coloring sheet. So the kids have they have fun coloring. It's nice. It kind of dresses up the hospital. And then the winners get a chance at some really cool prizes.
Holly, how about for you? Anything in particular? They seem pretty busy up at Clarion. So how about Butler Memorial Hospital?
So for Independence Health System, we get together to coordinate on all those days. We're doing the same thing at a lot of the hospitals. So the coloring contest, we're going to be doing that at Butler Hospital as well. And for like Green and Blue Day, we have like green and blue cookies you can buy, down in our cafeteria. So all the things that Christine talked about, we'll be doing at Butler Hospital.
So system-wide.
Yep.
That's fantastic stuff. Jared, how important is this month in terms of just awareness? Because as people get out there, maybe they're in the hospital for whatever reason, they see something like this going on, they hear this show. As people become more aware about it, because everything has a day now, everything has a month, but obviously it's still, this one is important. So just how big of a month is this for CORE, the hospital, just to spread the word about it?
I would say this is usually our busiest month.
Yeah.
We're all running around, going to our hospital partners' events, helping them with their events. We're doing our own events. We're working with community leaders and proclamations, and trying to get local businesses to even put up signs and participate and encourage their patrons to sign up as organ donors too. So it's not just CORE and the hospitals doing this. This is an entire community of the Western PA and the entire state of West Virginia kind of coming together, talking about organ donation and how important it is for everyone to sign up.
Well, if there is a community entity, a volunteer group or something like that wanted to help out and participate, what are the best ways for them to do that?
Sure. One of the best ways is to go onto our website, and there's a form that you can fill out, or you could just always email us at contactcore@core.org or give us a call. Those are the three easiest ways, and we're more than happy to We have a bunch of volunteers that go out and do events by themselves. We have a lot of donor families and transplant recipients that love going out to community events, to schools, to hospitals, to everywhere, and telling the story, whether it's a donor family and they're telling the story of their loved one and how impactful it is for their loved one to live on through their gifts. Or it's a transplant recipient talking about how wonderful and grateful it is that they were given a second chance and how important it is for everyone to sign up. So we have tons of resources for everyone. Just go on our website and you can find all those.
Holly, again, as we're coming here near the finish line, but if you just want to reiterate, from your experience, the hospital's experience, of just how important it is for somebody to become an organ donor.
Yeah, so I mean, it's very important, and like we've said, it's hard to plan for the worst day that a lot of us are going to, experience. But when you make that decision, you take that decision away from your loved ones to have to make, because I've seen a lot of families at that time disagreeing, or, and this is your way to be able to say, this is my wish, this is what I want to do.
Pre-planning and letting, again, as a family may be going through a tough time, this is not another level of something you want to add on to them. This is something you can do yourself. And then, Christine, for somebody that might be sitting on the fence, they've heard this and, they could be convinced that maybe this is the right way for them to go. What's your pitch to somebody who is on the fence about becoming an organ donor and why it really is the right move to make?
I would probably tell them that this is one of your biggest chances to become a hero. Although you may not know it, your family will know it. Your decision to become a donor could be the gift of life for someone or multiple people. And it changes not only that recipient's life, but it changes the lives of their friends, their family. It may give them the opportunity to see their children grow up and graduate and get married. It may give them the opportunity to become a grandparent. For something that seems so small, it really impacts so many lives.
Jared, again, one final time, in case somebody does want to register, if somebody does want to become an organ donor, what are the best ways for them to do it?
So the next time that you're at the DMV or renewing your driver's license, that's an easy way to do it. Or if you want to do it right now, just go onto core.org/register and take 1 minute and sign up.
And I'm sure people can find out more at core.org, right?
Of course.
Absolutely. Holly Burtner and Christine Baumcratz of the Independence Health System and Jared Bedekovich of CORE. Guys, thanks so much for taking the time. Really appreciate the insight and information.
Thank you.
Thank you.
Thank you.
Hey, if you missed any of our show, as always, you can find it online. WISR680.com is the place to take care of that. Let's Talk also available on Spotify as well. I'm Tyler Friel saying so long for now.
The information and opinions shared on this program are solely those of our guests and do not necessarily represent those of WISR, the Butler County Radio Network, or its staff and employees.